working together with the City of Victoria, BC Housing, and Island Health, we continue to dig deep to find solutions to address the situation at hand. I was just off the phone with BC Housing, and they continue to advise that they have been able to find beds for everyone who is COVID positive and wants to come inside as recently as 9 p.m. last night. But this work is literally bed by bed, person by person. Any significant increase in demand for these isolation spaces could put us in a difficult situation to guarantee people experiencing homelessness a space inside. That is an unacceptable situation. That's why we will be opening approximately 50 new COVID isolation shelter spaces across the city in the coming weeks. This will help ensure there is enough capacity for people who need a place to self-isolate or recover from COVID-19, even if we see a further increase in numbers. To leverage existing staff, the new shelter spaces include an estimated 30 beds in several locations within existing shelter and housing stock that have recently opened or will be made available over the coming weeks. An additional 20 pop-up spaces will be established at a new location, anticipated to be open in early November. This time is required to train staff and set up the space. While I understand some have called for a managed encampment, we do not require those spaces currently, as we are meeting demand as fragile as the situation is. My hope is to avoid that situation entirely. Even if we did require those spaces, we would not have staff to manage the site today. We have the same challenge with indoor space and are moving to address it by leveraging existing sites and staff. Island Health has asked that the locations of these isolation beds not be disclosed publicly to ensure the privacy of people who access these spaces, although immediate neighbours of the new 20-unit site will be notified by BC Housing. Similar to all BC Housing funded sites, these new shelter spaces will have isolation plans guided by Island Health for those who have tested positive for COVID-19. BC Housing will continue to work in collaboration with Island Health, the City of Victoria, and service providers to help ensure there are enough indoor spaces to get people inside, not just today, but in the weeks to come should this cluster of cases grow. I will now turn it over to Dr. Stanwyck to provide a few remarks.
Thank you very much, Minister Eby. I'm grateful to the Lekwungen-speaking people of the Esquimalt and Songhees First Nations whose traditional territories we are gathered on today. I acknowledge the Métis, Inuit, and other First Nation peoples who live in this region. Island Health, as an island, had 85 new COVID cases in the general public yesterday, 40 people in hospital, and we've added 3,500 new infections since the end of August. COVID-19 is present in all communities and all segments of communities on the island. The risk of COVID transmission from people who are unsheltered or have unstable housing to the general public is low. These are different times from earlier waves. We have a largely vaccinated population, and we know what works against this virus. When we all use our layers of protection everywhere we go, we minimize transmission to loved ones and to everyone within our communities. This includes getting fully vaccinated, maintaining appropriate physical distancing in the circumstances prescribed by the public health orders, following COVID protective measures in terms of personal equipment, and of course, very important, hand washing and staying away from others when sick. The risk of transmission, even with the Delta strain, when we follow these public health measures, is very low. For the unsheltered or unstably housed populations in the community with COVID, Island Health's primary focus is to provide public health support and health care services as needed. We have well-established and well-practiced protocols to ensure that our community partners and outreach teams deliver health care services to meet people where they are. Our outreach teams continue to engage in targeted efforts to support people who are unsheltered and those living in congregate housing to access both COVID immunization and health care services. People who are unsheltered or who have unstable housing do have additional challenges to self-isolate, as they don't necessarily have a single place to stay where health, shelter, food, and hygiene can be maintained. Provincial housing is a key partner in care planning. As you've heard today, BC Housing, the City of Victoria, and Island Health have been and will continue to work together to identify options to support COVID-positive individuals who are unsheltered or have unstable housing. Our collective goal is to provide individuals who are COVID positive, who are unsheltered, or who have unstable housing with appropriate shelter if they want it. As part of this work, Island Health has established temporary beds within the community for people of this group who are COVID positive and require medical support, but do not require hospitalization. Work to create more bed capacity for this population is underway, as you've heard from the Minister, and we expect to see the number of beds available to increase. We encourage people with COVID positive who are unsheltered or have unstable housing to follow public health recommendations to self-isolate as best as possible to mitigate the risk of transmission. Outreach teams are in place to provide support through the provision of personal protective equipment, troubleshoot individual situations as needed, and to provide referrals and linkages to community housing providers. Again, the risk of COVID transmission is mitigated when everyone practices the current public health recommendations asked of us by Dr. Henry and Minister Dix. And I close with a thank you. And as usual, I've lost my last page. Well, this is what happens when you over-prepare. Okay, I guess I left it at the podium. So what I do want to do is thank basically our partners, BC Housing, basically the Attorney General's Office, and all of our community partners who are engaged in this effort to house, and in particular, the next person to speak is the City of Victoria. I think just, this is a bit well, ad lib. I probably shouldn't do this, but just a true thank you for all the work that has led up to this particular situation, in that on reflecting on this last night, had this wave occurred much earlier, there would have been many, many more people in this particular circumstance. It has been through the tremendous efforts of the province, the city, and our partners in the community that we have been able to house so many, and that some of the problems in terms of housing have been created by us because we have in fact secured housing that previously might have been used on a temporary basis. So in some ways, we have made the situation more complex, but in a very good way. And I will close again with a big thank you to everyone who's helping with this particular situation, and hand it back to the Minister. And I hope to find my last page of my presentation at some point.
Thank you very much, Dr. Stanwyck. Mayor Helps will be speaking next.
Thanks very much, Minister Dr. Stanwyck. I want to begin with an acknowledgement that we are on the homelands of the Lekwungen-speaking people, and that we're in the aftermath of the first National Day of Truth and Reconciliation, and also an acknowledgement that a disproportionate number of people on our streets in Victoria are Indigenous, and that weighs heavy as we walk the path of reconciliation in the midst of a COVID crisis and pandemic. Thanks to the tremendous leadership of Dr. Bonnie Henry and our health system, the majority of the population in Victoria has been vaccinated against the COVID-19 virus. This has significant positive effects for everyone in our city as we're able to move around more freely, and also as supports have been made available for the unhoused population throughout the duration of this pandemic. The Minister mentioned the number of motels, congregate settings, and this is where people are staying temporarily as the province works to build over 280 purpose-built, brand new supportive housing units in the region. And we're really grateful for that investment. The city is in a difficult position because we have bylaws that need to be enforced. We have parks that need to be used for general purposes. And even while our bylaw officers are out there enforcing bylaws, which is their job, they continue to take a compassionate and measured approach to enforcement in regards to parks and in considering the needs of individuals as they encounter them. When encountering individuals with health issues, including COVID-19, city bylaw officers work with Island Health, BC Housing, and other service providers to connect people to the appropriate shelter or health services. We've been working together this week specifically to address the gap that has been identified, and I'll talk about that in a moment. Sleeping in a tent in a park is neither a housing or a health solution. That's why we're really grateful to our partners at BC Housing and Island Health for working tirelessly to ensure that there is space inside for everyone experiencing COVID-19 and needing a place to self-isolate. The pandemic continues to be a consistent and persistent health emergency. We wish it wasn't, but here we are. And we are continuing to rely on the leadership of Island Health and will continue to support all of their efforts to control transmission of the virus. As noted, over this past week, including an emergency meeting called on Sunday afternoon to address the gap that has come up, City of Victoria, Island Health, and BC Housing have been working extraordinarily hard to make sure that as we stand here right now, that if somebody has COVID-19 in the community and they are unhoused, there is an indoor space for them to go and stay 24/7 in order to self-isolate. Island Health has put in place a protocol along with BC Housing. Every morning a meeting is held. The number of COVID positive people who have no fixed address are identified. That list is given to BC Housing, who is doing a tremendous job of working with our nonprofit partners to find or set up self-isolation spaces for those people. So we're in a triage process right now. If somebody is identified on the street today with COVID and no fixed address, there is a place for them to go. But as the Minister noted, and as Dr. Stanwyck noted, we don't know what the next months and weeks hold, which is why we're really grateful to the province and Island Health for working so hard to open 50 new self-isolation spaces for people who are COVID positive and living on the streets. We look forward to doing everything we can over the next weeks and months to make these spaces a reality, and really grateful to the partnership that has been possible. There has not been one moment of finger pointing. There's been not one moment of saying, not my responsibility. What we've done for the last, 18 months, but in particularly since Sunday afternoon, is worked tirelessly to bring us all to this moment today where we can confidently say that if somebody is COVID positive outside, there is somewhere for them to go. I've thanked BC Housing and Island Health and obviously our bylaw officers. One more group to thank are all of those people who are working on the front lines, who are out there on Pandora in the various parks, the street nurses, the outreach workers. Without them bringing forward those names, without them working so hard to connect their clients with services, we would not be where we are today. So I wanted to make sure that they got a special shout out as well. And with that, I will turn it back to the Minister.
Thank you very much, Mayor Helps, and now we'll open it up to media for questions.
Thank you, Minister. A reminder to media on the line that you may now press *1 to enter the queue. That's *1 to enter the queue for questions. You will be limited to one question and one follow-up today. Please also remember to take your phone off mute, as you will not be audible until your name is called. A reminder that we have our speakers in 2 locations today. Minister Eby will lead on questions, but you're welcome to direct your question to any of our speakers. Our first question today comes from Lisa Cordasco with Vancouver Sun. Lisa, please go ahead.
Minister, sorry to change the subject, but I'm hoping to ask you if there is any legislation that you plan on introducing, either as the Attorney General or the Minister of Housing, in the legislature during this fall sitting.
Yes, Lisa, there is, but we're not announcing any of it today.
Okay.
You have a follow-up?
Okay, well, maybe I can ask, has the Attorney General recommended whether the issue of bubble zones, for example, around schools and hospitals should be dealt with through legislation, or if it's through policy changes? And if through policy changes, which laws or ministries would that come under?
Well, the Premier has been very clear about our government's profound concern about the possibility of health workers or education workers or students being interfered with by protesters as they go about their important work every day. My team is working very closely with Council to determine what the options are that are available for government, and we are taking this very seriously. I don't have any announcements about what approach we'll be taking today, but rest assured that government is preparing solutions to ensure that health workers and students and teachers and the workers at schools are able to go about their business without interference.
Our next question comes from Jimmy Thompson with Capital Daily. Jimmy, please go ahead.
Yeah, thank you. What's the nature of these 50 new beds that will be provided across the city? Are there going to be, for example, bathrooms? Are they congregate? Are they individual? What's the deal?
Sure. I'll speak generally about them. So the 30 of the beds are in existing facilities. So they will be leveraging the staff who are on those sites and the services that are already being delivered at those sites, although they will be isolation spaces and they'll be following COVID-19 related protocols. They will be using most likely the pods that BC Housing deploys in shelters. We have a number of the pods left over from the Save on Foods Memorial Centre closure, which will be redeployed. And that would be the case across all of the sites, as long as the sites allow the space for that. For the 20 units at the new site, those will be pods, and it will be opening in early November.
Jimmy, do you have a follow-up?
Yeah, I do. Mayor Helps, you said there hasn't been a moment of finger pointing or not my responsibility. Respectfully, I think that's what we've had quite a lot of in the last week. We've had BC Housing saying, ask VHA. We've had your own office saying, talk to Island Health. It's kind of been, that's been essentially the entire experience of the last week. Whose responsibility ultimately is it to care for people who are both unhoused and COVID positive?
Well, it's our collective responsibility, and while it may feel like finger pointing.
If your outlet or others have directed a very specific question that is more properly answered by Island Health, we will redirect to Island Health because we don't have the latest COVID data, the latest numbers. But I mean, clearly health and housing are provincial responsibilities, and I think you see today the Minister and Island Health standing up together, coming up with this solution. The city's role really this past week has been convening. So it might feel like finger pointing when we're redirecting a question that we don't have the capacity to answer. But what I can assure you of is that myself and officials from the city and BC Housing and Island Health have been in constant contact, sitting around Zoom rooms and coming up in a very short time. We had our emergency meeting on Sunday afternoon, and here we are today on Friday morning having delivered some solutions. So apologies if it comes across as finger pointing. We can't answer health questions, we can't answer housing questions, but we certainly have been working alongside health and housing. And from my perspective, the work is what matters, and the work is delivering these new units today.
Our next question is from Kylie Stanton with Global News. Kylie, please go ahead.
Hi there. This is a question for Dr. Stanwyk. Are you able to give us an idea of what the cluster of cases looks like in terms of the numbers or percentage of the population of those experiencing homelessness that have tested COVID positive?
What we do know is, in terms of just general rough numbers, is that we probably have about 300 individuals, and this includes everybody from visitors to some of these settings, staff members, as well as individuals who are residents and individuals who are in no fixed address. So it's basically being treated as a general cluster involving multiple sites. And in terms of the overall percentage, in terms of cases we're seeing, as I've emphasized, we've had 3,500 new infections in Island Health since basically in the last month. And so this is actually a very small proportion of the total number of cases. We are seeing many, many more cases in the 20 to 40-year-old age group than we are seeing in this particular population. So yes, it's important because one, this is a population we know that has a number of underlying challenges and issues, ranging from the conditions under which they're residing, their abilities to access food and health care. We have superb teams reaching out to this group routinely, and this is just an additional challenge that they are facing. And I think we've recognized right from the very beginning that we would be in a position to have to respond to spread the infection, because we looked at what happened at in the lower mainland, the downtown east side. So just as we did with other examples like long-term care, we took the learnings from the downtown east side, from Vancouver Coastal and Fraser, and tried to apply them as best we could. We were very assertive in trying to get vaccine teams out to these groups, literally knocking on doors, offering vaccine, which is still the best solution out of this, as well as making sure that people were made aware that should they become sick, we would, to the best of our abilities, accommodate them not only in hospital, but recognizing some do not have a great trust in the healthcare system in some other form, so that we could make sure that they did not have a severe outcome.
Follow-up.
Sort of building on that, I was speaking to Grant McKenzie with Our Place Society today. He says it's often difficult to get a portion of those in this population to follow simple rules like just not smoking inside or something. So can you speak to how difficult it is to have them self-isolate if they do test positive and ensure that they're not further spreading the virus?
Very much. We do recognize that this population, there are members of it who do experience a variety of challenges in terms of even basic rule following. And with that group, again, try to create structured situations that make it as as easy as possible, but recognizing that compliance may not necessarily be the greatest. Probably the most important thing is that those people around individuals who are having challenges in terms of being self-isolated, is that they themselves are protected with the personal protective equipment, and even more importantly, make sure that they're fully vaccinated. And this is why, of course, things are a little bit different, as I emphasized at the beginning of this conversation, in terms of the general public. We are enjoying an over 90% over the age of 12 first dose rates of immunization on the island, and certainly very high in South Island. And so, again, we do know that this is a population that clearly is experiencing challenges, but that we are in a different circumstance, say, than wave 1 or wave 2, where there's a fairly good bubble around them of people not necessarily going to be at significant risk, but we can then focus our basically interventions with our community teams to support the individuals through their illness. Again, are we looking at a perfect solution? No, but again, we'll try to accommodate them as best as we can. And again, we have resources, and in fact, Island Health has even contracted to provide additional primary care resources to this population, recognizing that they are not likely going to come to the usual sources of care, and that we are bringing the care to them. And this is what we have done in the past, and this is what we're doing for them with COVID.
Our next question is from Anna McMillan, CTV. Anna, please go ahead.
Hey there. I'm just wondering what's going to happen to these isolation spaces once the pandemic is over. Could these potentially turn into permanent beds?
No, the nature of these is that they are a temporary emergency response. The permanent beds that are coming online are new construction, long-term social housing beds that Mayor Helps talked about. So these beds will not be converting into permanent beds.
Anna, do you have a follow-up?
Yes, I do. For Dr. Stanwyck, I know that there's a big push to get those with unstable housing vaccinated. Are you able to quantify those efforts in terms of roughly how many people are vaxxed?
We have an estimate that we are probably looking at 30% of the population having taken up basically vaccine. As of today, we're emulating what Vancouver Coastal did, and will be offering an incentive program to increase those rates.
And those are all the questions we have today. Thank you, everyone, for joining.